Hello, I'm Rachel McKenty, Director of Programs and Development at Legacy Education. Thank you for joining me for the CPB Practice Exam Review, covering different CPB exam questions. In today's presentation, we will review the birthday rule and RVUs and RVUs. Question 1. Mrs. Fryer takes her son to the ED for an injured arm. Her son is covered by both parents. Mr. Fryer's birthday is October 14, 1984, and Mrs. Fryer's birthday is June 10, 1986. Under the birthday rule, whose insurance plan will be primary? A, Mrs. Fryer, B, Mr. Fryer, C, either one can be primary, or D, the parent's birthday closest to the child's birthday. Let's review the birthday rule concept. The birthday rule is a guideline used by health insurance companies to determine which parent's insurance plan will cover a dependent child first when both parents have coverage. Under this rule, the parent whose birthday, month and day, not year, comes earlier in the calendar year is considered the primary insurance provider for the child. The other parent's insurance then acts as secondary coverage. The birthday rule is typically used in situations where the parents are married or living together and both are providing health coverage for their dependents. In cases of divorce or separation, custody arrangements or court orders may determine which primary is supposed to be billed first, which insurance is primary. This rule and others like it are called coordination of benefits, also known as COB. In this question, Mr. Fryer's birthday is October 14, 1984. As reviewed, we would only use the month and date. Mrs. Fryer's birthday is on June 10th. Therefore, the correct answer is A. In this case, Mrs. Fryer's insurance will be primary. According to the National Association of Insurance Commissioners, under the birthday rule, the health plan of the parent whose birthday comes first in the calendar year is designated as the primary plan. The year of birth is not a factor in this rule. The month and day are the only factors the health plan considers. Question 2. What are the components that the total RVU is comprised of for physician services? A, conversion factor, practice expense, and malpractice insurance. B, physician work, practice expense, and malpractice insurance. C, sustainability growth rate, conversion factor, and malpractice insurance. Or D, sustainability growth rate, practice expense, and physician's work. Total RVU is based on three components of physician services: the physician's work, the practice expense, and malpractice insurance. The work RVU portion measures the time, skill, effort, and expertise required by the healthcare provider to perform a service. It includes factors like mental and physical effort, technical skill, and judgment. The practice expense portion of the RVU accounts for the overhead costs associated with providing care, such as office space, medical equipment, staff salaries, and supplies. The malpractice RVU covers the cost of malpractice insurance, reflecting the risk of liability that comes with providing the services. The total RVU is the work RVU, the practice expense RVU, and the malpractice RVU. Once the total RVU is found, it is multiplied by a conversion factor to determine the actual payment. So in this case, what components are the total RVU comprised of? B, physician's work, practice expense, and malpractice insurance. Question 3. Medicare payment amount for services are determined by which of the following factors? Sustainable growth rate times geographic practice cost index, total RVU times the conversion factor, total practice expense times the conversion factor, or total malpractice insurance times the conversion factor. Which of these equals the Medicare payment? Based on our review from question 1, the total RVU multiplied by the conversion factor is how we determine payment for services. The answer is B, total RVU times conversion factor. Question 4. Review this portion of the RVU table. Dr. Gregory performs the pre-op and surgery for code 12034, but not the post-op care. The approved amount for the entire service is $200. Using the table above, what will Dr. Gregory's reimbursement be for his portion of the service? First, let's isolate 12034 on the table. Now let's isolate the pre-op, intra-op, and post-operative portions of the table. Looking at the table, the pre-op portion is 10%. The intraoperative portion is 80%, and the post-op portion is 10%. Dr. Gregory performed the pre-op and intraoperative portions, which equate to 90% of the approved amount. The approved amount is $200, and 90% of $200 is $180. That makes our answer D. Review this RVS table. A physician performs a diagnostic laryngoscopy with biopsy and removal of separate laryngeal lesion. The patient has Medicare, which will pay for 80% of the approved amount after deductible for these procedures. The patient has met his deductible. The approved amounts are as follows. 13505 is $75, 13510 is $150, and 13512 is $200. What is the reimbursement? What reimbursement should the physician receive from the health plan? The RVS table shows that the multiple indicator for 31510 and 31512 is 3, which means special endoscopic rules apply. The table shows the base endoscopic code is 31505. No payment is made for the base code as it is bundled into the surgical codes. The highest paid code is 31512 at $200. So that is paid at 80%, which would be $160. The second procedure is paid after the cost of the base procedure is subtracted. Code 31510 is $150. So $75 is subtracted and the remainder is $75. Paid at 80% is $60. Total payment for the procedure would be $220. The answer is A. Thank you for joining us. For more CPB practice exam questions, please visit our website at medicalbillco.com.